The Psychological Aspects of Sports Injury by Cache Irvin. Injury overview. The injury is an anterior cruciate ligament tear, which is a tear in one of the ligaments of the knee that connect the femur to the tibia. Most commonly occurs during sports activities that involve sudden stops and changes in direction. The mechanism of injury includes suddenly slowing down and changing direction as in cutting, pivoting with your foot firmly planted, landing from a jump incorrectly, stopping suddenly, or receiving a direct blow to the knee. The treatment, depending on the severity of your ACL injury, may include rest and rehabilitation exercises to help you regain strength and stability. But often surgery is required to replace the torn ligament that is followed by rehabilitation. The rehab length is usually 8 to 12 months. Patient demographics. The patient is a female college basketball player that is a senior at the age of 21. She tore her ACL performing a plant and twist motion while dribbling the ball to the goal. The ACL tear is in her right knee, which happens to be the same knee that she tore her ACL in 2 years ago. The psychological interview occurred 8 months post-injury. When asked, on a scale of 1 to 10, 10 being extremely prone, how prone do you consider yourself to injury before you experienced this particular injury? The patient answered 6. When asked, when you were initially injured, how long did you personally think that you would be out of competition? The patient answered 1 year. When asked, what was the worst thought you remember having within the first hour or so of your injury? The patient answered that she thought she tore her ACL for the second time. When asked the question, prior to your injury, had you ever had similar feelings before? If so, what was that circumstance? The patient answered that she always felt that she was more prone to tear it again. When asked the question, did you have any ancillary responses to your injury, for example, lack of appetite, stress, or withdrawal from friends, etc., the patient's answer was,
I want to say depressed, like I was sad, like so I didn't want to do anything. Like I would literally lay in my bed, like just watch TV, just be by myself. Like I would even be on my phone.
when asked the question, what was your biggest fear in the days after your injury, the patient responded,
Honestly, just like literally like not knowing if I could play again.
when asked, what was the biggest complication from your injury other than pain, for example, couldn't walk upstairs, the patient responded,
I think in the beginning I was like hard because I literally couldn't walk because I was in so much pain. And then there are other examples of like not being able to sleep or like anything that was the biggest complication. Yeah, like sometimes I have trouble sleeping, like even now because like sometimes the pain will be really bad. And especially because like I sit down so I'm always on my feet. Like sometimes I really just hurt. Like before I go to bed or like when I wake up and stuff or my mental state too. If that makes sense.
when asked the question, did you feel any loss of connection from your team, either initially, after injury, or over time, the patient responded,
They all reached out to me, even like girls that I wasn't really close to. Like they still reached out to me and like just let me know that they were thinking about me and stuff. But
when asked the question, were you told or did you learn anything specific that helped you accept the situation or that improved your outlook of the injury, the patient responded,
no, not really.
when asked the question, what could have been told initially after your injury that would have improved your outlook? For example, everything will be okay. I, your caretaker, had the same injury. You're probably going to be out for 6 months, so let's prepare you for that. The patient responded,
anything would have like made me feel better like initially. Even now, like I don't think what people are telling me, like as far as like playing or as far as like my recovery, like as far as what they're telling me, I don't think it helps me feel better. Like at this point I feel like it's all on me.
when asked the question, what was your release that would help you take your mind off the injury, the patient responded,
Well, when it doesn't hurt, but me not think about it. If you go do anything, yeah, like if I found stuff to do that'll like I don't want to say distract me, but that's basically like what I feel like so like, at this point. What was distracting you? What would help? I've just been focusing more on my schoolwork. I've been catching up with like my old friends too. Okay. I've been spending time with them and my family as well. Yeah, just something out. Okay.
When asked the question, was there a turning point during your recovery that helped switch your mindset from generally negative to more positive, for example, saw improvement in function, physician visit, talked to another injured athlete, or tired of being upset about the injury, etc., the patient responded,
just because I started tolerating the pain more, like that helped me get to another. And also just like okay, wait, I need you to repeat the question. Just lingering away and like I was honestly just tired of being sad. Because like I do miss it and I still don't know if I want to play. But like I am around it a lot still, which is kind of weird. But it does make me happier to be around it because like we're not being around it at all. So that makes sense. Okay.
when asked the question, how motivated were you to attend treatment sessions, 1 being low and 10 being high, immediately after the injury, halfway through the injury, and in the weeks prior to being cleared to play, the patient responded 1 low immediately after the injury, 4 halfway through the injury, and 10 in the weeks of being cleared to play. When asked the question, what was your primary motivation to attend treatment sessions? For example, I wanted to get better as fast as possible, my coach made me, or I didn't want to let my parents down, etc. The patient responded,
I just knew that I had to come. And yeah. It's nice that I do have like personal relationships with everybody, so I think that makes it better. Okay. So maybe I came for y'all. I don't know.
when asked the question, looking back, what is one thing that no one had warned you about or did not emphasize enough about the injury and or the recovery process? The patient responded,
nobody told me it'd be this hard, like mentally. Like I feel like I had to pull myself out of places for so long.
When asked the question, looking back at the injury itself, did you learn anything about yourself after having gone through the process of recovery? And the patient responded,
I feel like I learned that I was a little tougher than I thought maybe.
When asked the question, has the injury and subsequent recovery changed your view on sports/life at all? If so, how? The patient responded,
yeah, because I was like if this time around, I was like, I really want to be able to walk when I'm older, like. So like that's another reason I don't know if I want to play because it's like at what point is it enough, you know?
When asked the question, what is the biggest piece of advice you would now give to a person who just suffered the same injury? The patient responded,
I could not take it too seriously, but like, what am I trying to say?
Like basically you're saying it's not the end of the world. Like
yeah, there's life like it can be a lot worse.
Okay.
Like, cause that's basically like what I've gotten from this too. Like, I just know my situation could be worse. But that's another reason, like, I tried to stop being so sad about it too.
Yeah. Questions for the athletic trainer. Having been exposed to the athlete's mindset after this injury, which may or may not have included characteristics of anxiety, depression, etc., do you feel that based on the situation that this athlete would have benefited from professional counseling during his or her recovery phase? I do believe that the athlete would have benefited from professional counseling during her recovery phase. Luckily, the athletic training staff was available to provide some comfort to her, but in another case with a different athletic training staff, another patient would have likely shut down and discontinued treatment, much like the lack of motivation that she had in the very beginning. Based on your exposure to the injured athlete's experiences, do you feel that any specific policies or procedures should be addressed or implemented during the post-injury phase for significant injuries? I do believe that a psychological interview should be added to the policies to be given to all athletes after a season-ending or surgical injury. This will help get an idea of if the patient needs this professional help before even starting the recovery phase. And I think it'd be very beneficial to all the athletes because of the effect that this type of injury has on them.